Good afternoon to everyone. I am Elango, nursing principal from KAPV Government Medical College, Trichy. I am happy to conduct this many classes to my nursing students in Tamil Nadu state. I think these classes will be more useful for the nursing student of diploma nursing, BSc nursing and post BSc nursing too. I hope you understand about this class. This class gives some solid informations at exact point with the PPT. So let's go to the topic now. This is my fourth video which shows the administration of blood and blood products to you. When you want to contact me, you can contact me through email for further slides and further video classes through email. My email is relango209@gmail.com. My cell number is 8838878726. Let's go to the topic to see the administration of blood and blood products. Indications for blood transfusion is actually if the patient get major injuries, blood loss, major fractures, those people require emergency blood transfusion. And if anyone patient has difficulty in breathing due to reduced amount of hemoglobin, this oxygen suppression gives more trouble to the patient. In order to increase this oxygenation, you need to give RBCs, so that supply of RBC is also a different types of blood transfusion. And some patient may have a disorder with clotting. In order to prevent that, they require some blood transfusion with clotting factors. Some patients may require some exchange transfusion. This exchange transfusion is taking out all the blood and blood products and plasma from the patient and simultaneously introducing the blood and blood products to the patient from the donor is called exchange transfusion. Then another one is to give protein and platelets through the blood transfusion is also indicated for the blood transfusion. The blood transfusion has got a different views, different types. Let's see one by one. The whole blood, all components of blood is a whole blood. It indicated with acute hemorrhage case, acute bleeding cases, hypovolemic shock cases require whole blood transfusion. Then RBC, that is packed cell volume transmission, is double hemoglobin and equivalent whole blood transfusion. The indication shows the severe blood loss, the patient with anemia. Sometimes patient goes for the operation, major surgeries before or sometimes after the surgeries, they require blood. So this RBC, that is packed cell, can be transfused. If the patient with a bone marrow failure also, this RBC can be transfused. This has got two types. This transfusion is a two types. One is packed and another one is frozen. Let's see. Before that, let's see the complication of blood transfusion. The blood transfusion sometimes may cause overload, sometimes cause some hemolytic reactions, sometimes it gives some febrile conditions, sometimes the blood gives some allergic effect to the patient. Rarely, sometimes this blood transfusion transmit some amount of disease to the recipient. Sometimes this gives increased electrolytes and increased citrus. Different types of blood products can be transfused to the patient. Say for example, this fresh frozen plasma, that is FFP. It has got a coagulation factor including factor 5 and factor 8. This FFP can be indicated the patient with hemophilia, bleeding disorder, the bleed persistent. Bleeding will not stop for few patients. That is hemophilia cases can get the fresh frozen plasma because the blood clotting factor 8 is present in this FFP. Clotting deficiency patient also can get this FFP. Patient with the shock, some patient with the coagulation disorders also can receive this fresh frozen plasma. Mostly the complication is transmit of disease like hepatitis, or sometimes the patient may have heart failure with this transfusion. Platelets also can be transfused for the patient rises rises by 10,000 millimeter cube. Single donor platelet transfusion also can be given. Client with the antibodies against platelet cases can receive this platelet transfusion. Especially the cases with a deficiency of platelet, thrombocytopenia cases, bleeding with the platelet, less than 10,000, those patients can receive this platelet transfusion. So mainly this type of transfusion complicated with fever, chillness, development of antibodies sometimes. That antibodies destroy the cells in autoimmune disorders. The cryoprecipitate also can be transfused to the patient if the patient factor 8 and factor 13 failure or fibrinogen defects and disorders can be given by the cryoprecipitate factors. Mainly the patient with the hemophilia and bleeding episodes cases can receive this cryoprecipitate transfusion. Granulocytes also can be transfused, increasing at tissue level. It do not increases the WBC. Indication is neutropenia cases can receive the granulocytes. Cancer cases, granulocyte destroyed by some medication administrations. These patients can get the granulocyte administration. It is very rare because of the complication. Pre-medicate with the steroid, antihistamines and acetaminophen should be given. Mostly, if you see these many complications with a patient, say for example, shaking, chills or rigors, stop for a while, administer meperidine 4 and restart the infusion when you start the this blood transfusion. These complications are not more complicated for the patient. You just see the next slide. If you see these complications in front of your view, this respiratory distress, cyanosis and chest pain is more complicated one. This is life-threatening complications. If you see these many complications, immediately you had to stop the blood transfusion and immediately you have to attend the patient and revive the patient. Nursing intervention, assess a previous blood transfusion, verify ABO compatibility, RH type of the patient, blood bag, no expiry date, blood bag number, expiry date by 2 nurses. 2 nurses are most important when you want to start the blood transfusion. Check vital signs before that and during and after. Transfuse slowly 2 ml per minute. Stay with the patient for at least 15 minutes. Only one nurse can stay with the patient up to 15 minutes after starting the blood transfusion. Okay. Yes, this is about duration. Whole blood can be given 3 to 4 hours. RBC can be given 2 to 4 hours. FFP can be given quickly. Platelet also. The cryo precipitates can be given rapidly. The granulocytes should be given over 2 hours. The volume expanders, it depends upon the patient condition. These are all the duration to give the blood and blood products. Document to be followed by the nurses is blood unit number,